Next, we will hear from Jim Accomando from the National PTA.
Good afternoon. My name is Jim Accomando, and I'm the president of the National PTA. Thank you for the opportunity to provide remarks today to the Federal School Safety Commission. I'm here today to represent the almost 4 million PTA members across all 50 states, DC, Virgin Islands, Puerto Rico, and Europe. And as such, I urge the Commission to please ensure its presence at future listening sessions and that they are held at times and locations that are conducive to hearing from more parents, students, and teachers. Our mission is to make every child's potential a reality by engaging and empowering families and communities to advocate for all children. We speak for every child, one voice. National PTA joins students, families, educators, school administrators, community leaders in the nation in grief over all acts of violence, including gun violence involving children and youth. Grief in thoughts and prayers are not enough. Enough is not enough. Immediate action from our nation's leaders is what is needed most right now. This year, our country has experienced 14 school shootings that have resulted in injuries or deaths. Parents should never fear sending their children to school, and students should always feel safe in their learning environments. It is imperative that we work together quickly to find solutions and make meaningful changes to keep our children safe. School safety is a critical priority for all parents, educators, students, and community members that cannot be taken for granted. We must make every attempt to reduce violence, especially incidents that involve firearms, and ensure every child can learn in an environment that is safe. National PTA urges meaningful parent and family engagement in the development and implementation of all school safety policies and programs, such as emergency and crisis response plans, discipline policies, and the access to school-based and community support services. Obviously, we believe the most effective day-to-day school climate is one that is gun-free. But we defer to local collaborative decision-making that engages parents and families to allow for the presence of law enforcement deployed in community-oriented policing. Our association has a strong history of advocating for laws and regulations in the areas of school safety, to include mental health, gun safety, and violence prevention, and supports the following policy recommendations. Many of these position statements and resolutions go back to the early 90s, with continuous updates and amendments. They include require universal background checks and a license to purchase a firearm, reenact a federal ban on the sale and possession of military-style assault weapons, lift any ban on research that studies the causes and effects of gun violence. Furthermore, we also advocate for preventative measures to educate students, educators, and community members on firearm safety and violence prevention, such as inclusion of violence prevention and intervention strategies in public schools and community programs and services, promotion of public education campaigns to alert parents and community members to the devastating effects of firearms and firearm-related violence. At the same time, National PTA urges federal, state, and local policymakers to prioritize mental health education, early intervention, prevention, and access to school community-based mental health personnel and services so that all children can reach their fullest potential. National PTA has long been committed to providing improved mental health programs and services to children, youth, and their families, and believes that all children and youth have the right to mental health treatment. National PTA recommends federal, state, and local policies prioritize outreach and education, including professional development for all school-based employees in schools and communities regarding childhood mental health. Resources are specifically provided to build mental health and behavioral health system capacity within schools and communities to ensure students can receive a proactive continuum of behavior and mental health services. States and school districts provide the necessary resources to ensure adequate ratios of school counselors, school psychologists, school social workers, and school nurses, who are the most qualified professionals to provide school-based mental health services. The time for additional studies or deliberation has long since passed. A framework for safe and successful schools, written and endorsed by our nation's leading education stakeholders and practitioners, already has the best practices and policy recommendations for school safety that this commission can promote. Our patience has run out. Immediate action to make schools safer is required. Parents, students, and families demand it. Thank you again for this opportunity to speak before the commission.
Thank you, Mr. Accomando.